Fox 31 Denver. News at 5.
Urgent care centers could find themselves on the front lines of battling Ebola if the disease continues to spread in the U.S. New tonight, Fox 31 Denver's Tammy Vigil joins us with how the industry is dealing with this deadly disease. Tammy?
Jeremy, the Urgent Care Association of America is providing its members with the latest information about Ebola through its website. There are 9,300 urgent care centers in the U.S., and their association says they are ready should Ebola walk through their doors. More than 3 million Americans visit urgent care centers a week. Here, colds and flu are common. But the Urgent Care Association of America is asking its clinics to be prepared for the possibility of Ebola.
We never thought that it could happen here. I think that's one of the shock factors. And additionally, it does have a much higher mortality. So if you are infected with it, you have a higher likelihood of dying than any of the other diseases.
Dr. William Cluckman heads up the association's fall conference in Denver. He says they're in the process of arming their membership with the tools necessary to care for these patients.
They will be thoroughly examined and a history will be taken. And if they present with signs and symptoms of Ebola, they will need to be transferred out via 911 to an appropriate hospital.
The association is using its website to provide members with the latest information on Ebola and how to detect and isolate infected patients.
International flights come into the U.S. at any time, and a new patient could present anywhere in the country.
But Dr. Cluckman says there is no cause for alarm. He says their current infection control procedures, like wearing a face mask, gown, and gloves, are enough to evaluate patients for the virus.
There are many other diseases that are really of greater concern here on American soil, such as enterovirus and even influenza, which kill many more patients than Ebola does.
Urgent care doctors would use this checklist here to evaluate patients for Ebola. One question on here is, did the person travel to an Ebola-affected area in the past 21 days? The Urgent Care Association says it does not want to scare the public, and the likelihood that we'll see more Ebola in the U.S. is very low. Tammy Vigil, Fox 31 Denver.